larger operating room. Now, when we initially designed the call series, we were going to split at this point into two groups. And we were going to talk to medium and large-size hospitals, which would be hospitals with more than 4 operating rooms, clearly. And we were going to split to a separate call for hospitals with less than 4 operating rooms, because we know that there are hospitals in South Carolina that have 2 operating rooms, that have 3, that have 4, and we know that there are hospitals that have 40 operating rooms in South Carolina. The technique for implementing is really the same. What differs is the pace of implementation. So I'm going to talk to you just a little bit about that. In a really small hospital, you could do a room and a surgeon every single day. Concentrate on one room, and I'll show you a little chart how you can plan that out. Talk to everybody on the surgical team before they use the checklist for the first time. Now, that's much less of a challenge in a small place because you know everybody. You've been working closely with them probably for most of the time you've been at the hospital where you work. You know those people very, very well, and having those conversations isn't difficult, and touching everybody isn't that difficult before you do something like this. So if we were going to make a timeline for ourselves, it might look something like this. Now, obviously, there's a million ways of doing this. You can use boxes and arrows, but this shows you a simple chart to lay a timeline out for a hospital that has 4 different surgeons. Now, you can see on one end is the date that we're going to do the work, and the service that surgeon represents that we're going to touch, general surgery and orthopedics in this case. An implementation team member who's been assigned to make sure that the checklist goes well that day with those folks, and then the surgeon. Now, you'll see over all the way on the right the anticipated difficulty. And this is the way that we would suggest that you think about how you order this. Now, it doesn't always work. The people who you think are difficult are sometimes easy, and sometimes the easy ones can present difficulties to you. But in general, this is how you want to do it. And I think if you look at it, it makes sense. On Monday and Tuesday, you want to learn the lessons that are going to help you on Thursday. So with the easy team, you want to get comfortable teaching people or showing them how or helping them with questions about using the checklist in their operating room. And then by the time that Thursday, July the 14th rolls around, you're all ready. You have a little bit of a way of doing it. You're comfortable asking the questions, and now dealing with Dr. Smink, who's a little bit on the difficult side, we can be ready to be able to answer the questions that team might have and to help them through running the checklist in their operating room.